It's at least 2 weeks. There's swelling for a good 2 weeks. It's much less painful as one would think. It's more of a tightness the first 3 or 4 days that subsides with time. You can be out and about in about a week after the facelift. It will be some bruising still and swelling, but if your work or personal lifestyle involves being very active and driving and being in front of the public, I would assure that they do need to be off about 3 or 4 weeks. The bandages are basically where the incisions are to cover them, to keep them sterile. A lot of times you also have drains that drains the fluid in between where the surgical procedure was, between the neck muscles and the skin, in between that area. So there are drains behind the neck. And the sutures that we use for facelift are different types depending where it is. So there's sutures in front of behind the crease of the ear. There's sutures behind the actual fold of the ear, and then in the scalp. So the sutures are removed 4 days after the ones that are in what's called the retrotragal area, which is right behind our tragus here. And then behind the ear is absorbable. In the scalp, it's 10 days later because we use staples, because staples are actually gentlest for hair follicles. We don't want the hairs to fall out.